Welcome to the next installment of our special topics on medicinal chemistry. This time, we are going to have adrenergic receptor antagonists drug or the blockers. These are drugs which antagonizes our alpha or beta or both alpha and beta receptors. They can be referred also as adrenergic neuron blocking agents or sympatholytic. These drugs act by interfering with the release of our adrenergic transmitter on our nerve stimulation. So first, we will have non-selective alpha blockers. An example of this category is TERAZOSIN. TERAZOSIN is a competitive alpha blocker and does not have any lipophilic substituents that is required for agonist activity. It has alpha-1 and alpha-2 blocking activity and it can produce tachycardia. The next category is called irreversible alpha blockers. So it can act on our alpha-1 and alpha-2, but the action of it is irreversible. It can produce a slowly developing prolonged adrenergic blockade. That blockade cannot be overcome by our epinephrine. So it is irreversible. The action of these drugs under this category is irreversible because of the structure called beta-haloalkylamines. These beta-haloalkylamines can alkylate our alpha receptors or can destroy it irreversibly. An example of our irreversible alpha blocker is phenoxybenzamine. This is a powerful alpha blocker and it can block our alpha-1 and alpha-2 receptors irreversibly. The biological action can produce or you can observe reflex tachycardia, cardiac and postural hypotension, and the onset of action is slow, but effects may last up to 33 hours to 4 days. As would be expected of a drug that produces such a profound blockade, administration is frequently associated with reflex tachycardia, increased cardiac output, and postural hypotension. So in our role as clinical pharmacists, we have to take note of this specific drug because its action in our body is irreversible. So it has to be given with very careful monitoring and strict compliance with the dosage and frequency to avoid profound side effects that can be experienced by our patient. The next category, we will have selective antagonists. And let's start with selective alpha-1 adrenergic antagonist. This drug has a parent structure called imidazoline or quinazoline. And the derivatives of our imidazoline or quinazoline are the phentolamine and tolazoline. These kind of drugs are unable to activate alpha receptors and behave as competitive antagonists of both alpha-1 and alpha-2 adrenergic receptors. The blockade of alpha-1 and alpha-2 adrenergic receptors can produce a reduction on the peripheral vascular tone and the systemic blood pressure. Therefore, it is useful to treat hypertension, or it can manage hypertensive crisis. Another therapeutic action it can give is it can help with benign prostatic hyperplasia. A newer example of our alpha-1 antagonist is TAMSULOSIN, Flomax, and Silodosin, Rapaflo. Another one is yohimbine, Yukon. So this one is the only clinically relevant alpha-2 selective antagonist currently on the market and is used to treat erectile dysfunction. I will show you, this is the structure of our quinazolin, the parent or the pharmacophore of our selective alpha-1 blockers. It consists of the quinazolin ring, the piperazolin ring, and the acyl moiety. But the main pharmacophore that makes it alpha-1 blocker is the quinazolin. So for this section, I want you to look for the structure of yohimbine, tamsulosin, and phentolamine, and identify or encircle the pharmacophore that makes it a selective alpha blocker. So our quinazolin is the one responsible for alpha-1 receptor affinity, while our acyl and piperazolin has a significant effect on the pharmacokinetic properties. So these are the different examples of our drugs. These three drugs have the same parent structure, but only they differ in the R substituent. So for PRAZOSIN, TERAZOSIN, and DOXAZOSIN, they have the same parent structure, but they have different substituents attached in their R portion. Moving forward, these three drugs also can block post-junctional alpha-1 receptor without blocking our presynaptic alpha-2 receptors. That's why they are used for treatment of benign prostatic hyperplasia, where they can help improve urination flow rates. But it can also produce first dose phenomenon, and sometimes it's a severe condition due to the comorbidities of our patients. This one is another example of our selective alpha-1 blocker. It has a quinazolin ring. Both of them has a quinazolin ring, but they have different piperazine ring in the center. So it has an open piperazine ring for our ALFUZOSIN, while for TERAZOSIN, it has a closed ring. Now for the difference in their structure, I want you to look for the difference in their therapeutic effect that is related to their different piperazine structure. Look for the structure and read for the literature if there are observable significant difference in terms of their therapeutic effect or activity, comparing TERAZOSIN and ALFUZOSIN. So they are both uroselective alpha-1 blocker, and they are useful for benign prostatic hyperplasia without utility in treating hypertension. So TAMSULOSIN is another drug that is an alpha-1A blocker, but it has no quinazolin ring. So its pharmacophore is called non-quinazolin benzene sulfonamide. It is also useful in the treatment of BPH with little effect on blood pressure. So this next slide will talk about selective alpha-2 blocker, which is yohimbine. Yohimbine is an indole alkylamine alkaloid, which is a selective alpha-2 blocker. It is found in the bark of the tree called Paucinistalia yohimbae and in Rawolfa root. The structure of our yohimbine resembles that of reserpine. It has carbomethoxy substituent lies in the plane of the alkaloid ring system. This yohimbine can cause increased heart rate and blood pressure. It is used experimentally to treat male erectile impotence. The next one is curinanthin. Curinanthin is also a selective alpha 2 blocker. So it has also a carbomethoxy substituent that lies in an axial position and is out of the plane of the rings. So they have the same activity, but they have small difference in their structure, and the difference lies according to their stereochemistry alone. Another example is our mirtazapine. This is a tetracyclic alpha 2 blocker that shows selectivity for alpha 2 receptor versus the alpha 1 receptor. Our mirtazapine is used as antidepressant and has an activity at non-adrenergic receptors. It is a potent blocker of our 5-HT2 and 5-HT3 serotonin receptors and at histamine 1 receptor.